Welcome everyone to the Dental Revenue Live podcast, where we discuss topics in dentistry with industry leaders. I am your host, Bill Mulcahy, and today's topic is going to be a great one, as we're going to discuss why it's important to align what you're saying to your patients with the visions and goals of your practice. Our guest today is Dr. John Cranham from Chesapeake, Virginia. John has been a longtime client and supporter of Dental Revenue, and we are absolutely honored that he's agreed to join us. Dr. Cranham is the clinical director of the Dawson Academy, which is a prestigious continuing education organization in St. Petersburg, Florida. John is also an internationally recognized speaker with over 25 years experience teaching courses and presenting continuing education sessions to dental professionals. He leads many seminars at the Dawson Academy and has been a keynote speaker for many conferences, including the Chicago Midwinter and Hinman Dental Society. John's insight on our topic today is without a doubt second to none. So please help me in welcoming Dr. Cranham to Dental Revenue Live.
So how you doing today, John?
I'm doing great, Bill. How are you?
Great. It's great to speak with you again, and I'm really happy to have you here with us, and I'm very excited about this topic. What we're going to go over today is basically discussing the concept of messaging and how, as a dentist progresses through their career, it becomes extremely important to align the messages they are communicating with their patients with the overall visions and goals of the practice. This is an idea that I know you and I have spoken about a lot over the years, and I know it's a challenge, or you've expressed it's a challenge for a lot of the students that have come through the programs at the Dawson Academy. But before we get started, I kind of want to give the listeners an opportunity to get to know you and a little bit about the Dawson Academy. So why don't we start with something simple and just tell us a bit about yourself and your practice.
Okay. So I was born up in Canada and moved down to Michigan at about 2. Grew up there and went to a small school in Ohio and ended up in Virginia for dental school, kind of by chance almost. But then, I ended up staying there and meeting my wife and bought a little practice in 1988. That was not the best time to be getting out of dental school because everybody thought there was too many dentists and dentists were going to go away. I was broke, so I bought a little practice that was pretty much all I could afford in Portsmouth, Virginia, and was lucky enough to hear Pete Dawson 6 months out of school, who sort of, got me on fire and kind of create a vision of the kind of dentistry that I wanted to do, and so we just started with a very simple bread and butter practice and began to work towards doing primarily comprehensive care and aesthetics and implants and TMJ, and so that's crazy, but it's 31 years ago now. So I've had a nice career. I've kind of seen the aesthetic revolution come and enjoyed that, and then implants was a surge, and kind of through all that, there's always been occlusal problems and people with TMJ problems. That's been a very, very fun career, both clinically and, of course, on the teaching side.
So what got you into dentistry in the first place? I mean, what inspired you to go into that field?
Yeah, it's interesting. When I was in Michigan, my dad was the first person in our family ever to even graduate college. So there was no doctors or dentists or anything in my family. But I had a job in the summertime on an inland lake in Michigan where I taught sailing and kind of was the one employee. I cut the grass, and it was just this little tiny yacht club on a little inland lake. And it's crazy, but there were two passions I had at that time. Is I loved to fly fish, and I tied all my own flies, and I liked working at that yacht club. And it turned out that there were a lot of dentists that belonged there, and a lot of them fished, and they would buy my flies from me, and I just was intrigued by their life. And their family, and they seem to be all happy and have time. And I was just drawn to it. Anyway, one of the dentists mentioned that one day that if I could tie flies like that, I'd be a great dentist. And it never occurred to me till that moment. And so I kind of went over to his office and saw what he did, and that's how it started. It's crazy.
What a great story. I know you've told me that before, but I just thought I just love that story. It's great to hear it every time. So, I mean, what about dentistry do you like the most? I mean, as you said, it's been a long time now, and so looking back, I mean, what would you say has been the best part of it?
It's a combination. I love the challenge of what we do. You know, there's just always challenges, and the kind of cases I'm involved with are challenging, and sometimes patients are challenging in terms of, you know, just what they present with, whether they can't open very wide or their personality or whatever. But I love the fact that we're, you know, I'm now with my patient base, I'm seeing, you know, the little kids that I saw when they were 2 or 3 years old. You know, I mean,
Yeah.
kind of three generations in a lot of these families. So I love that part of it. And on the other side of it is I love dentists. I love the whole teaching aspect of what I do and helping other dentists become better and have the life that they hope they could have as a dentist. So, you know, Pete likes to say that, you know, dentistry is almost like the best hobby. And I kind of look at it like that. I love I like working with my hands and solving problems, and I like the people. It's just, as a profession, we're incredibly blessed compared to, you know, some of my friends who are attorneys or accountants, and I think what we do makes a tremendous difference, and yet we can work pretty reasonable hours and make great income. And so I'm so fortunate that I kind of fell into it all those years ago.
Would you say that there's a type of dentistry you like to do the most? Is there something that stands out as if you have an opportunity to work on a specific case that's your favorite, or do you like kind of a combination of everything?
I definitely like doing anything in the anterior. I mean, I like doing veneers and I like doing implants, and I love anything that's up front. I think I think we're pretty good at it, and I think that it's what you seem to get the most spiritual reward from the standpoint of really changing somebody. So I really look forward to those kind of cases. It's been a big part of my career and my practice for sure.
Great. No, that's great. So you had mentioned fly fishing. So I think that's a good transition into my next question is, you know, outside of dentistry, what are some of your passions?
Well, definitely fishing. You know, it's funny, there's 15 or 20 years when my kids are growing where I didn't get to do it quite as much as I'd like. And over the last 4 or 5 years, I've really gotten back into it and been, you know, to all the streams around here, but also for the first time been to the Bahamas and to Belize and fish for bonefish and permit and tarpon and that kind of stuff. So I absolutely love that. And then the other big thing is we have a house at Smith Mountain Lake, and pretty much anything there, I just love being there, whether you know, on the water or not. We have a boat where we can do some wakeboarding and wake surfing. I've kind of retired from wakeboarding, but I do a lot of wake surfing. Wake surfing is not nearly as hard on the body.
Yeah.
So I love that, and I'm while I'm horrible at it, I like playing golf too. I'm just not a very good golfer.
See, you and I are kind of the opposite. I'm a decent golfer and I'm a horrible fisherman, but ironically, my 5-year-old son is extremely into fishing, and we were just on vacation and all he wanted to do was fish. So I got to learn how to do it fast. So that's kind of great, kind of interesting how everything comes full circle like that. So.
Okay.
Wonderful. so let's talk a little bit about the Dawson Academy. I mean, for the listeners that may not know a lot about the Dawson Academy, or maybe want to know a little bit more, can you tell us a little bit about that organization?
Sure. Well, it was started by Dr. Peter Dawson, and again, if people aren't familiar with him, they may not realize it, but a lot of the contemporary content devoted to occlusion came out of his mind and the minds of some of the people that he was working closely with in the 60s and 70s. He wrote 3 textbooks, true textbooks on occlusion. The 4th one was a book we wrote together with our faculty. It's more of it's called The Complete Dentist. It's almost the Reader's Digest version a little bit. And then he just finished his autobiography called A Better Way. But Pete, his mind in terms of being able to simplify extremely complex subjects was really his gift. And so, the Dawson Academy has always been devoted to teaching dentists how to do larger, let's say it this way, solving more complex problems, particularly related to occlusion and function, wear, mobility, sore muscles, TMJ problems, things like that. And so we have currently a core curriculum of 7 classes, basically 21 days of education that either can be done in person or a percentage of it online. And dentists from all over the world, we do it in several different countries and multiple locations in the U.S. And then we have an advanced restorative track and a couple of other advanced tracks that get into more sophisticated things like all on 4, all on 5, worn dentition, advanced TMD problems, sleep, airway type stuff, advanced aesthetic things. So, we're really trying to be the place where when a dentist wants to go from sort of the usual and customary dentistry that they learned in dental school, where they're working in, the patient's habitual occlusion or maybe single teeth or quadrants, and go beyond that and really have solid protocols for doing veneer cases or implant cases or changing vertical dimension or interdisciplinary type cases. That's what we help doctors do, is create protocols for some of these more advanced things, so they can have the same degree of predictability with these complex things as they do their regular bread and butter type dentistry.
Definitely. Now, do you see like a typical profile of a student that would come to the Dawson Academy? I mean, whether it's they're at a certain point in their career or they've sort of had an epiphany about the type of dentistry that they want to start doing. I mean, is there a profile of most of the students coming there?
It's really interesting. When I went through it in sort of the late 80s, early 90s, almost everybody was sort of, like 49 years old and just was tired of doing amalgams. I mean, they were coming to learn to do more advanced things. Now it's a broader, definitely broader spectrum. The average age of the dental student or of a Dawson student now is way younger. It's probably mid 30s, early to mid 30s, definitely split between male and female, all from all over the world. So all different, cultures and races. And, but I do think it's shifting a little bit earlier. And I think part of it's because of people are just living longer. And so the base patient that people see, there's just more complex things going on. There's more of a need to know how to solve functional and occlusal problems. And so people are recognizing that. I also do see some docs maybe that come in, not as many of them, but a percentage of them towards the end of their career, middle to end of their career, where they're have had great success financially, but are really looking to be able to really help the population that they're seeing that's getting a little bit older. As dentists, you tend to have a lot of your patients around your own age. And so as that population gets older, there is a greater need to be able to solve some of the problems that we teach dentists how to solve. But I would say generally it's a little bit of a younger crowd now, which makes it really fun.
Yeah, no, I think that's extremely interesting how the ages of the patients and the extended lifespan of a lot of the patients has really affected kind of the dentistry that needs to be done. So, that's really interesting stuff.
I also think that this aging population, their parents, a lot of them just went to dentures, and I think this aging population now, the boomers, they're wanting to keep their teeth, and
yeah, they don't want.
And if they can't keep their teeth, they want implants. So it's just the nature of dentistry, being able to solve more complex things, is definitely increasing and increased a lot since I started, for sure.
Now, we could have non-dentists listening to this podcast and potential patients of a Dawson practice. What does being a Dawson dentist mean to a potential patient or a patient out there that wants to know the difference between, what maybe they've experienced in the past with a dentist and a Dawson dentist?
I think the way to think about it is dentists in general are taught in dental school to understand how to diagnose and treat biologic problems, which is, might be problems with your gums, or it might be a decay problem with with teeth, where we learn how to solve get rid of the gum disease, or take the tooth out, or, fill the tooth. We also learn basic structural techniques, where maybe we crown a tooth or do an onlay to save the individual tooth. But what we don't really get a lot of training on is if the bite is not working. So if you're a patient that your teeth are wearing out, or you've got constant headaches from a bad bite, or you have a TMJ problem, or you've got the clicking and popping in the joint, the pain and headaches, we're not really trained very well how to do that. And so what a Dawson dentist will do is they will combine their knowledge that they learned in dental school about all the biologic and structural issues with a protocol or an understanding of how to visualize maybe a new bite that would manage the force better, maybe visualize a new position of teeth that would look great for a new smile, and be able to chew properly and speak properly. I think a lot of times dentists that haven't had the proper training may just try to do more teeth, and that sometimes will work out and sometimes it won't. So again, a Dawson dentist is going to be able to handle more complex problems. And so I see in my practice a lot of times patients that find us and are looking for somebody that is kind of beyond usual and customary that can do those types of things. And so doctors that train with us also experience a higher degree of predictability in solving some of those more advanced issues.
That's great. That's great. Now, you do a wonderful job at articulating that. Do you find a lot of the students that come through the program have more difficulties articulating that? I mean, is it something that is easy for the average dentist coming through the program to explain?
I just think it's variable. I think some people are naturally good at explaining things, and I think other people struggle with it. I mean, I know some dentists that are unbelievably good dentists, but aren't great communicators. And so I do think sometimes we have to help them with that, because it's terrible when we have somebody that can do this kind of dentistry, but maybe struggles a little bit with letting the world know that they can do it. And you have other people that maybe aren't as well trained, but they're really likable and slick and charismatic and attract people in that maybe aren't always satisfied with the results. So, we want to help our doctors that pay the time and the the sweat and the price and all that stuff of doing this type of dentistry at this level and get good at it and make sure that they're aligned with patients that need them.
Do you find that the ability to articulate the value is one of the biggest challenges once they go out into the world and start to try to implement this, or are there other issues as well that you see?
Again, it's doctor specific, but I have seen several dentists over the years whose gifts are with their hands and with their clinical knowledge and aren't as gifted with their verbal skills. I've seen other doctors who are really good at the verbal skills and have to work really hard clinically. So I think the most important thing for a doctor is to recognize where they're weak and then get help. Sometimes in a practice, it might not be even the dentist that is the person that should be describing what's going on. It might be a staff person who's really gifted at it. So those are the type of things we've got to recognize and think about and begin with that honest assessment of, if you're not doing the volume of dentistry that you would like to be doing, why is it happening? And you guys do a really good job in terms of helping dentists with that, and helping dentists set up a portal or a website that allows them to show their work and allows them to get known when people start searching for these problems. And as we both know, that's kind of where it is today. If people have a problem with worn teeth, they don't ask their neighbor, they go online and search worn teeth. I mean, that's what they do.
Yeah, and I really think that gets into one of the concepts we've discussed in the past, and really something that is near and dear to my heart is when people and when patients start to have problems, it becomes less of a decision on convenience. Like, this dentist is close to my house, or maybe he accepts my insurance, and gets more into, do I really believe through what this dentist is telling me that they can help me solve the problem that I have? So it becomes more of an emotional decision, and that emotional decision really drives the types of patients that I know you're looking for, and many of the dentists coming through the Dawson Academy are looking for as well.
Yeah, I think initially it's emotional, but I actually think for a lot of patients it's beyond that. I think for a lot of patients that have lived with pain and dysfunction, I think cosmetic stuff might be emotional, but a lot of the dysfunction stuff that we see, I see people that have traveled, across the country. Hundred nights, somebody from Charlottesville today, which is a 3.5 hour drive. And that's fairly common. And it's like you say, I mean, but what happens is you're exactly right. When there's a segment of the population out of there, and it's certainly not the majority. But if we look at where dentists are right now, the vast majority of dentists are basically fighting for the kind of patients that have insurance, that want cleaning. They're trying to be convenient. They're open from 7 in the morning till 10 at night. There's some dental practices today that are open 24 hours a day, 7 days a week. And they're trying to operate on the lowest fee, the fastest service, getting people in and out and on volume. And that's the exact opposite of what we're trying to do. And the great thing about, and you've alluded to it, but the great thing about being able to solve problems that most people can't is that we stick out a little bit. I mean, there's not as many dentists that know how to do that. And even though it's a smaller percentage of patients that are looking for that, there's even a way smaller number of dentists that can handle those type of patients. And since there are patients that generally have more complex issues that want solutions, you're exactly right. They appreciate it when we file their insurance and try to get some money back for them, but that's not why they're coming to us. They're coming to get their problem solved. And, I think that's a extremely important thing to remember is that when you get in that realm, all of a sudden you can start working when you want to work. I work basically 7 to 2 now. For a long time, I worked 7 to 3, but I backed that off another hour. Basically 3-4 days a week, a lot of times 3. But that's plenty for me. I'm 58. I'm slowing back down a little bit. I'm still teaching an awful lot, about a third of my time. So, but the point is, I can work pretty much the hours I want to work, and again, that's because that I don't need 60 new patients a month to do what I do. I need,
and I guess
6 to 8 good ones, and that's kind of how it works.
And I gotta imagine day to day, it's far more rewarding when you're helping people solve their problems than, working in the general day to day hustle and bustle of dentistry.
Yeah, I mean, it's a balance. We have a balance. I have an associate and a couple of hygienists, so we still do we still do the general stuff, but the vast majority of my time is more related to the more complex things. And again, it is what I enjoy doing. But again, it's just the way I'm wired, but I don't think I'd like dentistry if I was seeing 40 to 50 patients a day. And I like, one of the nice things about doing patients with more complex problems is the appointments are generally longer. There's more conversation about what's going to happen. And so in that time, you get to know them better. It's more relationship based. They're appreciative. They generally pay well. It's just, as you say, the word is rewarding, for sure.
Yeah.
On a lot of levels.
Well, I think that overall concept is a perfect transition as we come full circle back to our topic. And, as we get into this, I just want to kind of share a little story about how, we conceptualize this podcast and this overall topic. Over the years, you have been quite a mentor to me and Brian at Dental Revenue, and it really helped us not only learn dentistry, but dentistry from this perspective. And from that, we've really developed some really good synergies. And so when we get the opportunity to speak with you, really try to pick your brain as much as possible about how we can provide not only value to the dental market, but value to specific dentists like yours and dentists that want to have practices like yours. And one of the concepts that you introduced to us when we spoke last year was this idea of congruency and having to align the message of your practice at all levels with the vision and goal that you have for your practice. So could you kind of explain and kind of talk about that a little bit? Because I really find it fascinating, and I think it's very important as people try to maybe transition their practice into something like you're talking about.
Sure. I think the biggest thing that maybe the most important thing a dentist has to do from the beginning is get really, really clear about where they're going, and again, almost get away from their office if they can. I remember Pete Dawson talking about when he did it, he went into the woods and climbed up into a tree stand and sat up there for several hours over a couple days, and he was got kind of on a hunting trip, but he was really just thinking about his vision where to go. And again, I tend to do it at the lake on the water, and it's something you kind of got to do yearly, but you have to think about, your practice is always changing and the world around you is always changing. So it's really important to be thinking 3 or 4 years out what it is you want to be doing and what you want to be known for, and be thinking almost like, if at the end of my career, what do I want the people in the community saying about me? What do I want the patients saying about me? What do other dentists going to say about me? What are you going to be known for? And I think that's a great motivational thing to be thinking about. And the great thing about being a dentist is there's so many different things that you can do. I think after that, we talked about, then you can start creating the strategies of all the way down to the appointment book about, how would you schedule? How are we going to get the types of patients to be able to do that? And that's more my relationship with you kind of kicked in. But, the other thing that I think beyond that is that once that vision is created, it's not just the dentistry. So if you're trying to be, doing cases that most dentists can't, patients that come in like that expect a certain level of care. And so that means that, and that means that when they come in, they expect to be seen on time. They expect front desk people to stand up and welcome them, and look them in the eye. And they expect assistants to be well groomed and friendly, and they expect to leave your practice feeling a little better than when they walk in. And then beyond that, then the facility has to be, and we use the word congruent, but the facility has to be congruent with that vision. And it doesn't have to be a Taj Mahal, but it does have to be up to date, and it has to be clean, and it has to be in line with what it is you're selling. We've all had the experience. You've all had that experience of going to a restaurant that you've heard so much about. It happened to me actually last night on my daughter's 25th birthday. We went to a restaurant we've been a number of times, and the whole experience was kind of fell short of what we were used to. And so, we have to understand that when you're paying the dollars, or a patient is paying the dollars out of pocket now, and not billing the insurance, then the patient does have a legitimate reason to have expectations. And if you can exceed those expectations all the way across the board, from how they're handled to how the place looks, and on time, and finishing on time, and being smooth through the process, what I find is even when something doesn't go well, like I put in a 8-unit veneer case today, and the last time we tried it in, and I don't know whether it was our fault or her fault, but whatever reason, she didn't follow the protocol to take care of the provisionals, and so tissues were really inflamed. And so I couldn't put the case in, and we just had to make new temps and kind of go over it with her. Well, she was all the way in Charlottesville, and that is one of those things where she was expecting her teeth, didn't get them, but actually left appreciative that we were being so I hate the word picky.
Picky or detail oriented.
Yeah. But I think that was all set up before, in terms of how we did the exam, how he explained everything was going, and she took responsibility for that. And so, but I think there's a congruency there all the way across the board that allowed that to not damage our relationship. And she came back today, tissues were perfect, case went in great. So I think a dentist, as a whatever environment they're in, whether they're a business owner or associate, or they're working for a corporation or whatever, we still have the capacity. We have some capacity to control some of those things, and anything that I can touch and control about that congruency becomes really important.
So I think it's fair to say, as the dentist, decides they're sitting in their tree stand, or they're at their lake, and they decide that, hey, it's time to transition my practice. This is what I want from my career and my life. That it's not just a decision that they're making for themselves, but really the whole practice, because the message has to go down to everybody that's at the practice. And everybody really vendor-wise that works with the practice as well.
Yeah, and I also think that what you have to then understand is then it really does create what I call the clarity of choice for the team. And I remember when I took over the first practice, that Dr. Nicholson's practice, he was 74 when he retired, and and he had this a couple of employees, and when I decided about what I wanted to do and where I wanted to go, I mean, there were a couple of employees there that didn't they didn't share that vision. And so
Yeah.
it was tough, but those team members ended up moving on, but then it allowed me to search for people that shared that vision. What was really interesting was that the word kind of got around what I was doing, and then all of a sudden, people were sending me resumes, some really talented people that were actually not happy being in a usual and customary environment. So, so that clarity of choice for the team, we got to remember that a lot team members want to be where they fit, and so one of the things about having a really good vision that you can articulate is that the team will know whether they fit or not, and you don't really want people there that it doesn't fit. I remember seeing a really funny video by Kirk Barrett, who from Act Dental, talking about this, and to make the point, he was standing on the front of a rowboat with a little little horn that he was screaming through, and you could only see in the frame him, and as it kind of went back, you saw team members on either side paddling like heck, trying to get the boat going, and it wasn't going anywhere. When you finally got to the back of the boat, there was somebody back there paddling in the opposite direction. And, and I think we've all had an employee like that. And the thing of it is if you don't have a clear vision, then employees like that will tend to hang around because they just think everything is, they don't really know what the practice is about. So, and so I think that I think there are dentists, a lot of dentists that are sort of like that. They just feel like that they're out there to do whatever, and whatever sort of walks in. And we have the ability to be more specific than that. And I think the more specific we are, then when we talk to somebody like you, it makes it so much easier for you because now you know what to market. You know what to help.
Yeah,
them.
absolutely.
Yeah, and if
Absolutely.
somebody doesn't really have a vision, what do you do? Well, you almost have like a yellow page ad on the web, and that just doesn't work.
Well, that brings me to a good question and something that we've talked about in the past as well is, as you start to adopt this philosophy, as you start to try to promote this, one of the interesting stories you told me was early on just the struggles of trying to put together a portfolio book. And, so what have you, what have you done over the years? What would you suggest? What are some ideas or tips you could give to some of the listeners?
Yeah, I mean, the first big struggle is obviously being able to show people what you can do. And so, the first step, and this is maybe the hard part, is for our doctors that are beginning with this, is initially it's hard to get somebody to say yes, because if somebody wants to see work that you've done, you don't have any.
Yeah.
And so fortunately, what I did is, and I think this is what every doctor's got to do, is there's going to be people in the practice that already trust you, that have some of these problems, where you just start at the beginning. It's not going to happen overnight, and that's why looking at 4 or 5 year increments or 3 to 4 year increments is important. But there isn't any question today that if you can't take great pictures, that's the first thing you got to learn how to do. That's one of the reasons we put such a high priority on it in the academy early on, is if you can start taking pre-op photographs on everybody, that means eventually there's going to be a good looking case that you'll have the pre-op photograph. I know just about every dentist has a great case with no pre-op photograph, which means that case is useless from a marketing standpoint. So what's interesting is that what I did early on, and it's so funny now because it dates me a little bit, but I kind of took a bold move about year 8 in practice, right after I moved into my second office. And I was watching on our local cable channel, it was channel 11, there was a plastic surgeon that had a 30-minute infomercial on. and he would just have 3 or 4 patients, and and he would the patient would be talking about the pre-op situation, and then they would talk about what they wanted, and then Dr. Mladic would talk about what he saw, and then of course they would kind of go over the procedure, and then you'd see the post-op results, and before and afters. And I called the cable channel, and I think it was costing me at the time, I don't know, it wasn't crazy, but it was about $2,500 a month. But that included making that infomercial and running it, and I ran it right after the plastic surgeon. Now you got to remember, this was kind of
great idea.
This was, but this was pre-internet. I mean, the internet was there, but people didn't have websites. I mean, it was before all that, and so so I started to do that. And what happened was, I was about 25 miles from the ocean front of Virginia Beach, where a lot of these kind of cases were going on, and all of a sudden, people started coming out to see me. It really changed my practice because it got me sort of known in the community. But the key was, I had to wait until I had maybe a dozen or so really good cases, and then I had to find 3 or 4 people that would do the show. But what I learned from that, and this is why you've heard me say this, is that I think the mistake we make in marketing is we want to put our face out there and talk about our credentials. And what really is driving today's marketing is patients being able to see results. And often what will happen is, whether they're looking at a website, or back then, when it was that infomercial thing, people would say, I'm like Jeannie, I've got the same problem. They would identify with one of those people. And so we have to make it less about us and more about what we do, and more about the patients, the people that we've actually helped. And the more we can do that, the more, I think, success we're going to have. Zach Sizzler is one of our young dentists that has had great success with us, and he's done a ton with social media, Instagram and things like that. But his success comes from how beautiful his photography is.
Absolutely.
His photography is unbelievable. And so, 33 years old, he's doing case after case after case, and it's because people can see what he's doing. He's so good at it, we're actually going to bring him in and work with our team to a lot of things that he's doing that we can mimic. And with my daughter coming out of dental school, this is the kind of thing this is her generation now. This is what's happening. But what's great about that, that's not tremendously expensive to be able to do that. But it is a skill set, and you have to make it a priority. And then after that, everything's got to be congruent with it, because once you attract them, they have that level of expectation.
Yeah, it's interesting. Our last podcast was actually with Zach, and he was going over some of his, we called it do-it-yourself, DIY smile gallery, because he's been able to do within his practice, through the process you're talking about, just create a wonderful, wonderful smile gallery. So as you said, for somebody at his point in his career to have that many cases up there, is a real testament to what he's doing. And, he's been very, very successful with it. But,
in a part of Pennsylvania where it doesn't make sense that it's happening,
exactly.
That's the other thing about it. He's not sitting in Manhattan. People are driving a long way for him to do work. It's really
absolutely
cool.
One of the things about your website and overall approach that has really been endearing to me over the years is really the use of your patient videos. And one of the real neat things you do with your patient videos that I think comes off as just so genuine and unique is, in addition to the video of the patient talking about their experience with you, you have a video of yourself talking about your experience with the patient. And it just is a very nice approach and good touch, and really falls in line with everything you're speaking about. But when you start to seek out these patients, or when you start to identify the cases you want to use to promote, do you have any process or any thoughts that you go through to make these decisions? Because I can just remember one of the girls had TMJ problems, and you just literally changed her life, in her words. And another was somebody that had been coming into your practice as a delivery guy for years, and you helped him with his smile, and his grandson came up to him and said, "Pop, you have the whitest teeth." And these things are things that have stuck with me over the years, and just are very endearing. Do you have any advice or thoughts on how do you come to that point?
It's funny, that came from me copying what that plastic surgeon was doing. It's really funny, but I watched what he did, and I may have done it. He played that out a little bit more than he did, but I do think that one of the biggest challenges we have as dentists is, particularly as we get a little bit along in our career, and maybe we get a good reputation or whatever. One of the challenges with that is that often patients are intimidated of us a little bit, and I think it's important for us to remember that whenever we can, if we can show a human side to who we are, I think that in today's world is important, because I think most patients don't want to look up to a doctor maybe like our parents did, so
yeah.
if we're coming off like we're in this ivy tower and we kind of seem a little arrogant or whatever, that's going to turn a lot of people off. And so I was intentional about that. I wanted to make sure that in our discussion that I had the opportunity to tell my side of the story and what I learned about the patient. And it's really interesting. These things are sometimes filmed, a couple of days apart, and I don't even really know what the patient said until it's all mixed together. But it is cool when they mix it, how congruent it is, how in sync what happened. And I think that's important, because that's why I don't like, I've seen some people where they will have like scripts or things like that. I think that's a real mistake. I think it's better to just put the camera on and let them tell the story. And if they flub it up, then just do another take. But it has to come from the heart. It's got to be real. You can tell the real stuff from the fake stuff. And then the other thing that I would tell you is, don't necessarily think that there's sometimes people will say, "I'm so nervous and I don't want to do it." And of course, sometimes they really are nervous and they're bad. But other times the nervous people are the best ones, because they come off the most authentic. So you don't really know. The best thing is to just line up some patients and get somebody in there that can do some video. You can help them with that. And then the person videoing has to be pretty good at asking the questions. But I do think it's not a bad idea for the dentist to jot down, be a little bit of the producer there, and kind of think about what you want said. And but
and then it's up. Go ahead. I'm sorry.
I was just say, I do think what you said is important and I appreciate it from the standpoint of that I was pretty intentional about that process of making sure that we were, I had some input about the patient, because there again, I want it to be seen about how I really care for the patient, and that's a big part of who we are.
And it absolutely ties into everything we've said today and everything you shared with us. And on that note, really, I have one last question, and I like to end all of our calls this way to sort of summarize everything. And obviously, you've provided us with a lot of great insight and advice and tips. But if you had to leave the listener with one thing or a couple things that are most important for them to consider as they start to try to make this transition, or maybe they've made the transition but are struggling to get there? I mean, what would be the advice? What would be the first thing you would tell them to do?
The first thing I would tell them is to not underestimate where we are in dentistry right now. I think we are sitting right now at maybe one of the best times ever to be a dentist, because of what I was talking about earlier with the aging baby boomer population and the volumes of problems we have from the standpoint of functional issues, wear and tear, and people wanting to keep their teeth for a lifetime, people not wanting to go to a denture and literally spending, so much money to have their mouth restored back with implants. So that's the first thing. Make no mistake that this right now, I think the next 15, 20, 25, 30 years may be the best time ever. Last population that really grew up without fluoride, so there still tons and tons of amalgam in their mouths, and they're going to be living longer than their teeth. That's just the way it is. Yeah. So they're either going to need their mouth restored, or they're going to need teeth replaced. But the other side of it, this population are highly educated consumers. So as you pointed out, they're not just going to assume that they're going to get the same level of work by the guy in the corner. So that means today you've got to get trained. You have to go out and pay the price to really be able to solve these problems and not just pay lip service to it. So Dawson Academy, I mean, that's kind of where we sit, and it's what I'm excited about what we do now, because I think we're poised for just unbelievable growth and helping the doctors that want to do that. And then secondarily, as you get that work on the shelf, be crystal clear with where you want your vision to go, what you want to be, surrounding yourself with the right team in the practice and outside the practice, the right lab relationship, people that can help you market that, and then just have a ball. I mean, then just enjoy it. Don't expect it to turn overnight. This is a marathon, not a sprint. But what I promise you, if you pay the price and you go down this road, you're gonna all of a sudden wake up one day and be in a completely different place. And I just, one of the things that saddens me a little bit is that what do I have? Maybe 6, 7, 8 years, something like that. I'm gonna work. Work until I know my daughter can do what I do. She's my most important student, and she'll be with me in a year, so that's really cool. But I'm just so positive about where we are right now, and but I do think that the sad reality is I think probably 80-85% of dentists are going to miss it, because I think most dentists are choosing to chase the volume route. But the ones that want to be able to solve problems that most people can't are going to have a hell of a good time. And that's what I'm committed to helping the dentists that want to do that.
I love it. I think, everything you shared with us today has been just great and very inspirational. So I certainly appreciate you taking the time to do this and really bring people through some of your journey and tell us about the Dawson Academy, and then ultimately tie it back into, the steps they need to take to really make sure that as they start to make this transition, that everything they're doing aligns with these new values and goals. So thank you so much for your time and really giving us this information today, John.
Absolutely, Bill. It's been a pleasure. And again, keep doing what you're doing. You're helping a lot of our guys, so I appreciate it.
We appreciate you guys as well. So this really concludes our call for today, and I want to thank John Cranham for being our guest, as well as Sarah Alexander, who's John's specialty care coordinator, for really helping me coordinate this time and getting into John's schedule. I also want to thank Nicole Bonin, who's really on the dental revenue team, and she's behind the scenes doing a lot of work on these podcasts. We really appreciate that. And if anybody would like information on John as a speaker or information regarding his lecture schedule, we'll provide you with links to that in the podcast. Also provide information about the Dawson Academy and a link to their website. And ultimately, if you're interested in finding out more about how you can improve your marketing, messaging, and really trying to get this message of congruency out there, just feel free to give me a call here at Dental Revenue, and we can sit down and talk about it and talk about where you are and where you need to go. So our next podcast will be in a couple weeks. It'll be with Dr. Doyle Freno talking about how he uses his video gallery to improve case acceptance. And so before I sign off, I just want to say thanks again, John, and really give you the deepest appreciation for giving us your time today.
Nah, it's my pleasure. It's fun talking to you, and I'm sure I'll be talking to you soon about our next vision and where we're going.
Absolutely.